everybody, I'm Tessa Knight. I'm a research assistant for the Digital Forensic Research Lab, part of the Atlantic Council's think tanks. And today I'm joined by Aisha Abdool Karim, who is a reporter for the Bhekisisa Centre for Health Journalism in South Africa. Aisha, thank you for joining us on our DFR Labs coffee breaks.
Thanks for having me.
South Africa is no stranger to health-related misinformation, from myths and rumors surrounding HIV/AIDS and ARVs to the growing community of people who don't believe in vaccinations. In your opinion, what are some of the reasons that health-related misinformation spreads so rapidly? And do you think the South African government and civil society are doing enough to combat this spread of fake information?
Yeah, so I think the first thing we need to do is just identify that there are some key differences between the HIV/AIDS epidemic and the COVID-19 epidemic that we're seeing now in South Africa. So when we had HIV and AIDS, there was a huge series of AIDS denialism from the government, and there was really a lack of clear information and instructions coming through, and political figures were actively endorsing herbal remedies and moving away from providing information and admitting the facts and science behind the HIV epidemic. What we're seeing in COVID-19 is almost the complete opposite, which is, there is really strong leadership coming out of the government, and particularly the Department of Health right out of the gate, in identifying this as a public health emergency and something that needs to be addressed. There's been very clear attempts to communicate the scientific facts and put out the right information, making sure that everyone is aware of what this virus is and what steps they can take to prevent the spread. Where we are facing a difficulty with COVID-19 is that it is a new virus. And so at the beginning, there was a lot of confusion just because there were so many things that were unclear. And I think that's something we just have to recognize, is that it may not have been active misinformation so much as we were sharing facts and information as we became aware of it. So for instance, the messaging amount around masks changed quite drastically. In the beginning, there was messaging that there was no need for people to go out and purchase masks, especially medical masks. And as we learned more and we saw what was happening globally, the government then came out with a policy that it's now mandatory for everyone to wear a cloth mask when they're out in public. So that's kind of an indication of how things are different in terms of how the information sharing is changing as we learn more with the COVID-19 epidemic locally.
So one of the things that the South African government did is make the spread of COVID-19 related misinformation and disinformation illegal. Do you think that that has had any impact on the spread of fake information, considering it's not necessarily something that's been replicated throughout the rest of the world?
It's interesting how they've used that regulation, and I think it's very fair how they've implemented it, which is, I think that it's being utilized in a way that is to curb harmful misinformation. So things that can actually impact the country's response and people's actions. And I think in that sense, it has been very effective in how they've dealt with that type of misinformation. So for instance, very early on, the government announced this community surveillance program in which people would be getting screened and tested in their homes, and community healthcare workers would be going out to do this kind of program. And a video was circulating. I think it originated on Twitter and it made its way onto like WhatsApp groups, and it got circulated quite widely, where someone was claiming that these tests were actually going to infect you with the virus. And I think the government's response to that was quite rapid. As soon as the video was identified, they put out several statements, making it clear that this video is false, that you shouldn't believe this, that the testing program is not going to infect anybody. And the person who circulated the video was actually charged under the regulations that make the spreading of fake news or misinformation illegal. So in that sense, I think there has been a very effective move when it's a circumstance like that, where the video actively incentivized people to disregard government protocol, which would have been when these community healthcare workers showed up to people's homes to do the testing, people refused to get tested or be screened because they were worried about getting infected. So that's a real consequence that we saw from that. And that is why the government came down very harsh in terms of, stamping out that type of misinformation.
I was wondering maybe if you could speak to some of the things that the rest of the world could learn from South Africa and the way that we've been fighting misinformation around COVID-19 and how we've dealt with it in the past and how we've learned from it.
Yeah, completely. So I think one of the biggest lessons that we can definitely take away from South Africa's response is that it has always been very clearly science and evidence-based first. And I think that's something that was communicated very early on from the government, and particularly the Department of Health coming out at the front and being like, every response, every move we make is coming from an evidence-based origin. We're taking consideration of what is happening elsewhere in the world. We're looking at how other countries have responded to this thing, and we're looking at the science and the medical basis for these decisions, and we're integrating that into how we're responding locally. Additionally, I think a very strong move that we made very early on was that the Department of Health formed a ministerial advisory committee for COVID-19, which comprised of over 50 experts, which consists of scientists in various fields. And these scientists, essentially what they did was they drafted advisories and they gave feedback to the Department of Health and to the minister directly on key issues. And that feedback was then passed on and formed part of our national guidelines. And I think that is definitely a very important move that we made, which is making sure that all of our policy at the start was strongly informed by medical experts and giving very strong emphasis to what scientists believed was the correct approach that we should be taking. Additionally, I think there is a lot of confusion around COVID-19, and I think that confusion exists both among experts, but especially among members of the public. There is so much that we didn't know in February that we know now, and even now there is still so much more left to learn because everything is so new. And I think what South Africa did that was very helpful is it started holding public briefings and media briefings, but also public briefings, where the minister and the president would provide information that clearly outlined what we knew so far and where we were going with our response. And I think that was very helpful to get everyone on the same page. And I think it helps to just be upfront, like, this is what we know, this is what we don't know, and this is what we're trying to do. It has somehow fallen short in the recent, in the past few weeks. We've sort of seen a shift away from this in terms of implementation of regulations, where we're starting to see that confusion creep back in because there's scientific evidence for something, but it's not being explained how it's being implemented when it comes to regulations. And so that has led to some, I want to say, almost like disillusionment with the national lockdown that we've put in place and how we're practicing certain things and our policies for COVID-19 now. But very early on, this was a strong move that was made by the government to have clear communication and make sure that everything was coming from experts, and that we like emphasized the value of having scientists give their input as opposed to discrediting what these people are saying, and making sure that the misinformation is not highlighted, and instead we're making sure that we're giving accurate facts out to everybody.
I think something that I would add to that is that the government gave out a number that people could send a message to on WhatsApp, and they would receive updated information directly to their phones on WhatsApp. And as a country, South Africa has a large number of people who use WhatsApp. So that was a very good step, in my opinion, that they took to try and get information to the public in a way that people are able to consume it easily. So we both ended up reporting on a mayor of a city in Gauteng, which is one of the provinces in South Africa, who said that he was planning on using city funding to purchase an alleged COVID-19 vaccine. And he doubled down on Twitter, and he told people not to read headlines and to go and listen to his statement and not to take the news at face value. And he was referring to interferon, which it seemed quite a lot of people got on board with and wanted the South African government to purchase from Cuba. What are your thoughts on what happened there after debunking the statement itself and doing some research on interferon?
Yeah, so I think that was an interesting case, particularly, there were a lot of myths going around. There was a lot of misinformation circulating about different potential cures and remedies and stuff. But at that point, it had mainly been herbal remedies, like we discussed, like the garlic and lemon and stuff. And I think when this mayor, he was the mayor of a district called Ekurhuleni in Gauteng, and during, it was, I think his state of, I don't know what it was, during during one of his addresses, he publicly said that he was going to use government funding to purchase a COVID-19 vaccine, which he then later, I think, came out and said it was this thing called interferon, which came from Cuba. And so while I was watching the address, this was then also supported, he said, by the Gauteng Provincial Department of Health. And so this was something I picked up on because while watching the address, I was obviously like, this is a very big claim to make, that you're going to start using government money to support something that at this point there's no evidence to support, because we know very clearly, like, there's no vaccine or any medication for COVID-19, because this was still in like March or April when there was very little information going around. So I think, when it comes to reporting on misinformation, there's a very fine balance that we have to draw between highlighting harmful myths and then also holding people accountable and making sure that the correct information is going out. So at Bhekisisa, we made the decision, because he was a public figure and it was going to be using government funding, that this is something we should look into and something that we should report on. And, going into it, it was, it became very apparent that interferon was not a cure, not even a valid treatment, in fact, on its own. There was no scientific evidence to support this. And that, I think, was very clear upfront, that, medically, he was definitely incorrect. And so when we did the article, he actually then started responding to it on Twitter. And he, claimed that I had misrepresented what he had said and that he had never claimed it was a vaccine. But, if you go and check the videos and the quotes, it's very clear what he said and what he claimed. But it was interesting that as soon as I had reported on it and we made that very clear that what he was saying was factually incorrect, he actually started to backtrack on that statement and sought to clarify what he meant. And in fact, there was a change to the national guidelines on medication that specifically mentioned interferon as a result of that. So I think, you know, in cases like that where you can see tangible changes where it's actually going to make a difference and benefit people, it's really important to call out misinformation in that sense. And I also did, you know, several pieces around medication. You know, in the US, Trump promoted hydroxychloroquine, which is an anti-malarial drug. I think he still continues to promote it, even though there is now strong evidence to say that it doesn't work. And locally, how we saw that impact was that even though it hadn't come from local government and it had been an international piece of misinformation, I will call it that, we saw that chloroquine, which is the version of that medication that was available locally, which was being used for arthritis patients and for other, it's not used for malaria anymore, it's used for other illnesses. People had started buying chloroquine, and we were actually experiencing national shortages of that medication as well. I think we are still continuing to experience shortages. So that's, when it comes to people promoting medications, it becomes really harmful because, you know, then the public is uninformed and they go and seek out these medications that are, you know, don't have any proof to support them, could potentially be harmful. And then it also deprives people who actually need access to those medications further down the line. So I think in instances like with this mayor and with the chloroquine, it's really important that we correct those facts to make sure that we're preserving treatments for people that need them, and we're also not promoting, you know, people seeking out medication when we don't know the effects it's going to have on them, you know, either with COVID or without it.
On that note, Aisha, thank you so much for joining. My last question is, I know it's about 20 past 2:30, so it's a bit of a peculiar time during the day to maybe have some coffee, but I'd love to know if you do drink coffee and how you take your coffee, and if you don't, then maybe you could just explain to me what kind of tea you have so that we could drink some with you next time we have.
Yeah, I mean, I'm not a tea drinker. I mean, I'm not a coffee drinker personally, but I do indulge in a lot of tea. I'm a tea addict. It's very simple. It's just black tea with a little bit of milk and sugar. And that's me. I'm very simple like that.
Well, that's perfect. And thank you so much for having us. And we will look out for your reports at the Bhekisisa Centre for Health Journalism.
Thank you. Thanks for having me. This was great.